Hello, and welcome to our Cancer and COVID live Saturday series. I'm Dave Fuehrer with Grit. I'm an oncology researcher and a two-time cancer survivor. We started this Cancer and COVID interactive series to create space for connection, space for conversation, and space to come together through this experience. These interactive sessions are about leaning in, sharing what we're each dealing with, interacting with each other, and with the experts who are on the front lines facing COVID. Because when thinking about COVID and cancer, we have to now think differently. I was talking to our panelist from last week's Saturday session. Listening to Dr. Ashkar talk about his expertise as a physician and his experience as a lung cancer patient helped me realize something about my own journey. I've never shared this before, but listening to him helped me realize how much I never had words to talk about how cancer was affecting me. Growing up, my father was an Army veteran. He had PTSD, and we knew there was things we didn't talk about. When I went through cancer twice in my 20s, I didn't have a language. I didn't have words to talk about my fear or what I was going through. To my family and my friends, I looked strong and I was doing well because that's what I told them. But inside, I was full of turmoil and uncertainty that I didn't know how to talk about. I held all that in for years until I saw others having a voice and finding words to talk about what they're going through. Seeing that helped me find my voice and change my life. It is a miracle to me every time I see someone find their voice, find a way to share what they're facing, and find a way to ask for help. It is life-changing. Many of the things that we were each doing now feel eclipsed by COVID. Our team with Grit has been focusing all of our energy on rising to this new challenge. This is a challenge not just to our physical health, but to our humanity. Losing who I thought I was before cancer is what created my purpose in life. It allowed me to connect more deeply to my own humanity and to find my grit. Going through cancer helps us find our grit. Everything I am and everything our team is with Grit is about supporting humanity when something threatens it. Even as cancer patients, survivors, and caregivers, COVID is creating a new level of uncertainty for many of us today. Our culture is literally changing around us. We are in our homes. Some of us are losing our jobs. Some of us losing life. It is like the world has a glimpse into what going through cancer is like. But COVID will pass. And what it teaches us is perspective. So I would like to start the session today by inviting you to share what you're going through. May I ask, what word describes how you feel about COVID? Please use the chat box on the screen to share. I'll give everyone just a moment. I'll ask a few questions and then we'll keep going. The second question that I would love to know from everyone is, how is COVID changing your life or changing your family's life? Please feel free to share that as well. The third question, if you're still typing, just to think about, is what do you hope most to hear from these sessions or to learn from these sessions or anything else? And I have one more question before we move on. The last question is, what are you thankful for? Thank you for sharing those for those who did. Thank you for reflecting on them for everybody. Starting last week on March 28th, we kicked off this global cancer and COVID series, where each Saturday we bring together a cancer patient who is dealing with COVID, a medical provider who is treating COVID patients, and the scientific experts who are working to diagnose and treat this new virus. We are bringing together the advocacy leaders who are supporting their cancer communities through COVID to share the resources and expertise they are providing to support our humanity, our health, and our hope. And most importantly, we are bringing together all of us, the community, the ones who are living each moment. We deserve connection, information, and hope. To make all of this possible, GRIT has partnered with the American Association for Precision Medicine. These are remarkable scientists, doctors, and humans. I am honored to now introduce Dr. Mishra, the founder of the
Thank you, Dave. Thank you, GRIT team, and thank you all for joining us this Saturday morning. And thank you, Dave, for sharing your story. I think it reminded me a lot of things, and I think this is what this forum is about, to come together to share our experiences and try to see how we can make a difference in each other's lives, actually. I believe there are two ways to live life, so the usual way where we go out and we seek ourselves by interacting with other folks, right? That brings us meaning, and that brings us fulfillment, that brings us a sense of connectivity. But I also believe that, going inwards, actually within yourself, and having time to do that is the most sacred thing one can ever have. So if not, what I say is that, so if not for the fear, just let's be thankful for having that in our lives right now. And that's what one thing I would request you all to come together to try to, not come together, but come be one with yourself and trying to find your true self. And I'm sure you will, we all will come out as winners, as more powerful, more regenerated, and more, more experienced from this crisis. So like Dave touched upon some spiritual, his spiritual journey, and I still remember I was giving a talk in Utah, and there's this patient and his wife came to me, and then we were discussing, and he suddenly started crying, and I was like, why? And I didn't say, but I was like, why this person is crying? And he came, and then I had a conversation with him, and for some time his tears won't stop, and he said that, Dr. Mishra, if it wouldn't be for cancer, I will not discover my spiritual side, who I am. So I am a cancer survivor. I went through all my life, but it's cancer and that woke me up and helped me understand my spiritual side, who I really am. And he said, I am thankful for this opportunity. So, and then he said something remarkable that has stuck with me and still is with me. He said that, Dr. Mishra, if you give me a choice to live that mundane life, routine life, and cancer, I will choose cancer, because this has transformed who I am and what I have done with my life, and I'm looking forward to doing. So with that, thought, I will leave you with that. And I don't have many things. I think I was going to share a few slides, but I think that can wait for next time. So let's move on with the panel, and and be relaxed. And always remember, fear is a very strong emotion. So what fear does, it empowers all human emotion. So if you live in fear, you are blocking all emotions. You're blocking the abundance, the prosperity. You're blocking everything. So one has to come out of the fear. I know we are isolated. But then it also sometimes staying with yourself is frightening because you are now sharing the space with yourself. So I would request you to just be one with yourself and try to form that union, which I think will lead to gains in your personal, professional, and at large at large humankind. So with that, thank you very much. Welcome to the Saturday morning episode 2 of Cancer and COVID.
Thank you so much, Dr. Mishra, for that warm introduction on behalf of the American Association for Precision Medicine's ACT Coronavirus Task Force. My name is Arun Sivanandam, and I'll be the session moderator for today. I'm so excited to be here with all of you and speak to all of you. I actually am a clinical trial specialist. I deal with investigator-initiated in phase 1 through 3 pharmaceutical industry-sponsored trials focused in rare disease, GI, and neuroendocrine oncology. So it's within the cancer space, and it's within a very small part of the cancer space called gastric and neuroendocrine tumors. I've always had a passion for studying cancer as personalized care for patients. I thought I was going to become an oncologist. In my final year of medical school, my dad, who was a practicing cardiologist, a heart doctor, he got glioblastoma, which is one of the worst forms of brain cancer. And I went to become his patient caregiver, primary caregiver in my final year. Did everything I could for him. We got him through chemo, we got him through surgery, we got him through radiation treatment. We even enrolled him in one of the leading clinical trials for glioblastoma. But he passed away, unfortunately, 1 year after his diagnosis. And so I decided at that time to switch over and devote my full-time attention to research and clinical research in oncology. And I also became a staunch cancer patient advocate as well. I joined the American Association for Precision Medicine as I was approached by Dr. Mishra. I thought it was a great mission as what they were trying to do for personalized care and serving as a knowledge base. And I thought in this current climate of the coronavirus and COVID, creating a task force and labeling it ACT is very, very appropriate because we all need to do our part to help out. As part of the American Association for Precision Medicine, I serve as a chair for collaborations and team manager on different committees such as diagnostics, therapeutics, and data science. The cool part about that is they say that you build things based on being on the shoulder of giants, but I get to rub shoulders and have coffee with these giants every day on this task force, which is very exciting. Now we have an amazing, distinguished panel here with multiple members that I'll be introducing. We have a cancer patient and survivor on the panel. We have a cancer advocacy group on the panel. We have multidisciplinary experts, including a clinician as well on the panel. And I'm really excited to bring all of their expertise as we explore different topics around COVID and coronavirus today for you. I just want to give a shout out as well to one of my mentors, Dr. Kamala Madali, who has really been encouraging me and is a strong force behind this collaboration between the American Association for Precision Medicine and Grit Health. And I want to thank Grit Health as well for this opportunity to reach out to the cancer patient community at large. Just as a disclaimer today, a few quick points. Even though we have these experts and they're coming from various reputable, distinguished institutions, all of the views that they're going to be presenting today are going to be their own and not on behalf of their institution. Additionally, if you have specific medical questions regarding your condition, it should really be directed towards your oncologist and medical team because they know the most about your condition and the best care options for those. But I do welcome you to ask your questions and we'll try to address them as much as possible. Thank you all of you as attendees for joining. While I'm introducing our distinguished panelists, I'd like you all to take some time and in the chat box, let us know, where are you joining from? Where in the world are you joining from? Let me know how the weather is. We'd like to know. Just to give you information, it's about 50 degrees here and I'm kind of in Palo Alto, California. It's getting better, but it's still a little cloudy outside. As well, I want to thank all of you who are joining for the first time. Please do mention if you're joining for the first time and you're returning from last week's session as we're continuing this conversation. And don't worry, even if you missed a session last week, we do have the session recorded, and so you'll be able to catch up as well. So let me get started on introducing our panel. We have Cathy Ormerod, who's the Vice President, Programs and Partnerships of Living Beyond Breast Cancer Foundation. Cathy is responsible for overseeing the implementation of all direct service and partnership initiatives in support of Living Beyond Breast Cancer's mission. This includes leading efforts that increase public awareness of Living Beyond Breast Cancer's mission, overseeing the development and implementation of educational programs and services for those affected by breast cancer, and helping to cultivate and develop the foundation's relationship with new and existing partner companies. She has more than 25 years of experience in the nonprofit and academic sectors, especially in areas of communications, program, and organizational development. One fun fact is that she's an active member of a dragon competitive boat team, which I think is really, really cool. Welcome, Cathy. The next member I'd like to introduce to you is Curtis Garbett. He's a bladder cancer survivor and founder of Crush It for Curtis Foundation on bladder cancer advocacy. Curtis was diagnosed in February 2015 with papillary urothelial cancer. In December, they found that it was stage 4 bladder cancer. At that time, he underwent several cycles of treatment, and he's still here today as a warrior for bladder cancer advocacy. He founded Crush It for Curtis Foundation in 2017 with the aim of accelerating cancer research and connecting the people who need it the most with medical researchers. His Crush It for Curtis Foundation strives to build long-term relationships and alliances, as well as to stay innovative, to continue to improve and best help bladder cancer patients and men facing men's health issues. We also have with us Dr. Piyush Mathur, who is a staff anesthesiologist and critical care physician at Cleveland Clinic, Ohio, with more than 20 years of clinical experience. He's also the Quality Improvement Officer and chair of the Compliance Committee of the Anesthesiology Institute of Cleveland Clinic. After completing his medical school training, he completed residency in anesthesiology and fellowship in critical care and quality. A recognized leader in critical care, quality, education, and artificial intelligence applications in healthcare, Dr. Mathur has led many of the local and national programs, including serving as the chair of the Postgraduate Education Committee, Coding and Documentation of the Society for Critical Care Medicine. He's also trained in computer programming, machine learning, and deep learning, and he's the founder of BrainX, an AI and healthcare application and research development company. He also founded one of the largest groups for machine learning in healthcare, a BrainX community. Welcome, Dr. Mathur. So glad to have you on board with us today. We also have Dr. Catherine Benedict, who's a clinical assistant professor at the Stanford Cancer Institute. She is a behavioral health researcher and clinical psychologist, passionate about developing evidence-based digital health interventions that support patient experiences, optimize clinical care, and improve health outcomes. Her groundbreaking work focuses on improving adolescent and young adult cancer survivorship. Projects include building digital health resources to support survivors in managing late and long-term effects of treatment, including physical, psychosocial, and financial difficulties, while identifying strategies for improving adherence and clinical care experiences. She's part of the Grit Health team, helping to develop an app for cancer survivors to receive targeted, tailored information and peer support, and she works closely with several patient care organizations supporting their efforts to improve adolescent and young adult cancer outcomes. Thank you so much for joining us, Dr. Benedict. Wonderful to have you on board with us here today. And finally, we have an amazing special guest. We have Swamini Shraddhanatha Saraswati, who's a co-founder and executive director of the Kula Kamala Foundation. Swamini is the founder of this Kula Kamala Foundation and a yoga ashram. Her path to spiritual ministry was activated and empowered by years of education in the teachings of Hinduism, yoga, mindfulness, and spirituality. The basis of her practice is to explore faith and what it means to be human, to be spiritual, to suffer, and to heal. Welcome, Swamini. So glad to have you on board with us today. Let's look at where everybody has said they were dialing in from before we begin. Wow, it looks like we have people all the way from Wisconsin, from Rochester, Pennsylvania, Texas, San Francisco, among some others that I'm reading here, Cleveland, Ohio, North Dakota, Glendale, New Jersey, Panama. Thank you so much, all of you, for joining us today. I'm going to be asking our panelists some questions, and we're going to have a conversation. Feel free to chime in with your questions, and we'll get to them as the session continues. Now, the first question I'd like to pose to you, Cathy, with the Living Beyond Breast Cancer Foundation. Cathy, the theme has been that a lot of planned events, educational and social gatherings have been canceled in order to do strict social distancing. How has your organization dealt with this? And what are some new methods of connecting individuals and cancer patients that you have explored?
Well, thank you for that question. It has been a challenge for us, but we are meeting the moment. We do a combination of live events as well as online activities. So we, like many other nonprofits, have had to change our business model overnight. One of our largest conferences is our annual metastatic breast cancer conference, and that's held each April, and it was scheduled for the middle of this month. But we knew early on in the crisis that we also had to take care of our constituents and honor their health and protect their health. So we were really grateful to find Dave and Grit Health and to transition that conference onto an online platform. We are hearing from our breast cancer community that all their concerns about treatment, and some of which are in the chat box. People who are in treatment have millions of questions. People who are wondering, are they immunocompromised? So we are also interviewing oncologists, also other healthcare providers, to deliver that information 2 to 3 times a week through Zoom videos, through podcasts, and through other writings that we do on our website. So we are really digging into our mission of connecting people to trusted information and a community of support. And we have additional online Facebook groups that we have started to continue our community. We have leadership volunteers all across the United States who are answering questions through our peer support helpline. And we are trying to get information out because people are scared. We know it's a health crisis, it's an economic crisis, and as everyone here has mentioned, it's a spiritual crisis. So digging into our mission of providing trusted information and a community of support is something we are doing. We are even offering yoga on Friday nights through Facebook Live every Friday night at 6 o'clock. And we are hearing from our constituents, and we know the economic impact this will have on people and their health care. If they're losing their jobs, if their health care is discontinued. So we are beginning a fund that will address this. So we are trying to meet everything head on through virtually, as well as through the communities we have established, but expanding them. So thank you.
Thank you, Cathy, for providing that perspective and how you guys are trying to come together to really meet these changing needs in this critical time by doing things online. I love that idea of leading yoga sessions and hope that your members are really enjoying some of those virtual-led yoga sessions as well. I would like to direct a question next to you, Curtis, if I may. It seems like you've been going through a lot with your journey with bladder cancer, from diagnosis to treatment to now surviving with it. Can you talk briefly about that, and how has that journey provided you strength and resilience to deal with these kind of times?
Sure. Yeah, I've been dealing with this, with bladder cancer for about 4.5 years now. And I have gone through several treatments, from chemotherapy, participated in clinical trials, also finding out that my cancer carries an FGFR mutation. So I've been able to participate in some targeted therapies that have been very successful. And then had some surgeries because they thought there was possibly some other cancer that was forming in the bile duct area, which actually it was my urothelial carcinoma. Then I went on MVAC, if you're familiar with that, which is a very strong chemotherapy. And then I had to come off that because it was just too strong. It was just really taking my quality of life down. And I was having a trip come up where I was going to Maui with a bunch of other cancer survivors. And so I really wanted to be feeling healthy and good for that. And so going on that trip, I had no idea what I was going into. I've always been one, even when I was first diagnosed with cancer, to be the strong one. You know, when I was going through chemotherapy at first, I was being strong for my mom and for the rest of my family. But when I was on this trip in Maui, in connecting with other cancer patients, it was like this brick wall was just starting to kind of crumble, and I was just getting more in touch with my feelings and knowing that what I'm thinking and what I'm feeling is normal. In just connecting with a whole new, we refer to us as an ohana, a family. And so right now I'm growing more in that area, in allowing myself to feel and share those things. And I'm on a new treatment now that's very, very new, called enfortumab vedotin, that was just approved by the FDA, I think within the last couple of months, targeted for bladder cancer. But during this time of COVID-19, I mean, it's extremely scary for me. I was supposed to go to treatment not 2 weeks ago. I think it was, 2 weeks ago. And I actually canceled my treatment because I was just afraid of going out and being exposed. So I made the decision not to go. This Wednesday, just this past Wednesday, I went to treatment, and I felt like I was entering like a war zone at the hospital or something. I mean, I had to go through all these checks and answer all these questions, and it was just very weird and very scary. And I was being very conscious of making sure, I wore a mask the whole time I was there. I was washing my hands a dozen times. I was, making sure I was staying like 6 feet away from people. It was just a very strange time for me, but I had to go because I needed my treatment. And so now I'm home. I made it through it. And now I'm kind of self-quarantining again just to make sure I didn't expose anything. But I feel like I'm living the same day over and over. Thank goodness for this opportunity today to speak, because it does change up my day a little bit. But yeah, it's very strange. Sometimes I feel like I'm in the twilight zone. So.
Thank you so much for sharing that and sharing your personal journey, Curtis. You have been through a lot, and you are doing tremendous. And thank you so much for giving back to the community as well. I think you brought up the concept of ohana, which is family. And so I think we're all trying to grow our family, whether that be virtually via Zoom, as we're doing right now, or via text, or via phone, or via video call. So I really appreciate your efforts. And I know, even being at the Stanford Cancer Institute, that you have to go through several checks, even as a healthcare professional, to get into the building, if it's a healthcare building. So those are difficult to deal with. And I can imagine that already having the burden of having to worry about what kind of treatments you're going for and whether you need to go in or not, these can be additional pressures that can raise your stress and anxiety levels. And so I appreciate your candid honesty as to how you've been going through that and what that experience has meant for you as well. Now, I know you mentioned some of the new targeted therapies that you're being exposed to, either as a result of clinical trials or approved FDA therapies. And so I kind of like the way that that's going in general, because that feeds into the concept of precision medicine, which is what we're trying to do today. We start off with a frontline therapy, and then we try other therapies later on. But those therapies that are being developed are extremely specific. They're either targeting one specific receptor on a cancer cell, or they're targeting some kind of immune response or a lack of immune response. And so it's really nice from my perspective to see the research that's being done for that, as well as how those are being translated into unmet patient care needs for people like you in the bladder cancer community and beyond.
Yes, thank you.
Now, I'd like to ask you a question, Dr. Mathur. Let's start off really simply here. Research suggests that the overall clinical consequences of coronavirus, or COVID-19 as we call it, may ultimately be similar to those of a severe seasonal influenza or a pandemic influenza. Just break it down for us a little bit and let me know and let us know, how is COVID-19 similar to the flu or the cold, and how is it different?
I think that's a great question. And I think a lot of us are still trying to understand this. When you have a situation like what we are in an early pandemic situation, I think the data that we have, the information that we have, and when we look back at these early days, will be proven wrong in many fronts. So to try to compare or contrast it with any other pandemic or epidemic, I think is truly not right. I think we are in real early days to understand this better. And there have been a lot of models that have been built And one simple way to help people understand is that a lot of these models which project about the path of this COVID pandemic are not different from how you model the data for a hurricane. And if you think about how that hurricane data modeling is done, when a hurricane is being formed somewhere, it's going to take a different path. It's going to be different strength. And as that hurricane goes along, a lot of models are created trying to predict where is it going to hit and with which strength. But you'll realize when you look at those models, a lot of them change. And they change not just because of the hurricane's nature itself, but because of other external forces. So I would say we are right now early in this. It's hard for us to compare and contrast, but as has been said multiple times, that this is the only hurricane, I believe, where we can, as in humans, can really change its course and strength. This is the only hurricane I know of. You truly cannot, that is, humans truly cannot change the path or the strength of a hurricane. This one, we can.
Thank you so much, Dr. Mathur, in talking about how we are trying to understand the early stages, and we're trying to understand what this disease is and what it's doing to people, and how even in trying to understand that in the early stages, we're having to deal with a shifting hurricane almost that is changing. And so the information seems to be changing as well as to recommendations and what we should and shouldn't be doing. And I know that in your facility, you also serve in the capacity of disaster planning and management. Walk me through what that looks like with all of this changing information, where you start planning for your day at the beginning and how that looks like by the end of the day, and how you're trying to deal with changing that and changing even the way your operations planning and management occurs.
Yeah, again, as a full disclaimer, what I'm going to talk to you about are my personal opinions and don't reflect, Cleveland Clinic or any other organization that I represent's views. But I can tell you this is true for all the healthcare systems. We are, first of all, at the forefront of treating every single patient. And that includes the current cancer patient. So whether you are a COVID patient or you're a cancer patient, we are treating everyone right now. The only things that have been postponed in some areas are elective procedures. If your hip surgery can wait, we are waiting for that. We want you safe. So the first and foremost effort is about making sure that our operations and our treatment plans are going through for each and every patient. The second part is about planning for this pandemic and how do individual organizations absorb all the information that is being thrown at us and create constructive plans for local application. Now, you have seen what has happened in Italy, New York, Spain, China for that matter. Everybody has different amount of resources. Everybody has different skill sets. And every organization is taking the best possible plan and implementing that locally. I have seen immense amount of innovation that has come about in such a short period of time. Now, a lot of you are cancer survivors, you have received cancer treatment or are fighting this battle. And you have seen how long these randomized controlled studies take, how long it takes us to innovate. But this pandemic has brought all of us together. We are all in it together for our patients and to protect the healthcare workers. And the pace of innovation is tremendous. So that is the second part of what we're doing: preparing, innovating, learning, and then following up on the data that we are gathering to see how we can save every single life.
Thank you so much for those views and opinions and being candid about how that looks like and how we're taking a strategy to really act, as it is called. We're all trying to act together. I think one of the things that you brought up was how we are shifting the focus from things that are more elective in terms of elective visits or elective procedures, kind of putting that off to prevent people getting further risk of exposure and doing only mandatory things right now. And so I'd like to shift and continue that conversation to you, Cathy. My understanding with the current COVID crisis is that for women with a personal history of breast cancer, that we're trying to avoid screening mammograms or breast imaging in women who do not have health concerns that are immediately pressing. How do you deal with that in terms of getting opinions from experts about the safety of that and educating the community about dealing with concerns around new policies for women?
Great question. And we are getting many, many questions from our constituents. This past Friday, we posted an interview that our CEO, Jean Sachs, did with Dr. Monique Gary, who is a breast surgeon in Pennsylvania. And she was laying out what is happening in terms of screening, in terms of postponing only the most serious surgeries. So people are afraid, how is this going to affect my cancer care? And she also gave a very comforting message that the NCCN and the American College of Breast Surgeons are working on new guidelines to adapt to this crisis. And I think that's a really important message for people to understand and take in, because it calms their fears that doctors are very much attending to what is safe now, who can go safely into a surgical treatment room, and who shouldn't in order to safeguard their health, long-term health. So she was very comforting. It was wonderful to be able to pass that information on to our constituents who are very worried, and people in treatment are very worried. And as Curtis described, walking into a hospital, it is terrifying these days, depending on where you are in the country, of course. But we trust that our healthcare providers are really looking out for the patients, and that they are in touch with their doctors to understand what is happening. Of course, we're concerned that people are not being screened, but those who need to be screened, who find a lump, who, flag issues, or who need surgery because they need to get that cancer out, they will be getting those treatments. So that was a very comforting message from Dr. Gary.
Thank you so much, Cathy, for sharing that. It's nice to see that you have a reach with your organization for experts to be able to talk about those changing guidelines, and to see that professional organizations, including the NCCN, is actively looking at projecting those established and agreed upon changing guidelines out to the healthcare professionals so that they can start educating, along with patient advocacy groups, to the patient care community as well. And I think that's extremely important. Now, Dr. Mathur, I'd like to come back to you for a question. We explored this concept a little bit last session. I know some of the attendees are new, and so I just want to come back to it. Some public policy concepts floated in the public domain are social distancing, now rebranded as physical distancing, and flattening the curve. Can you help break down the concept of social or physical distancing? And how does that really help flatten the curve? And why do we need to flatten the curve?
Yeah, no, I think that's a great question. I think we've been hearing this time and time again, and a lot of us understand sports very well. So let me start with sports analogy. And in sports, for most of the sports, we have different quarters and like first half and the second half. Unfortunately, this has been a terrible first quarter for us. We didn't know our offense, so our defenses were the right way. We didn't play well along each other. We didn't learn from each other that quickly. But I'll tell you something. The second quarter is going to look very, very different. I think with all the testing and all the different therapies that are coming, the second quarter of this game is going to look very different. And the second half, I'm pretty sure we will prevail, and we will definitely defeat this virus. In the meantime, till we get to that, we need to have a strong defense. We need to make sure that this virus doesn't keep scoring and doesn't break through our defense each and every time. And when we do this defense, what we need to do is to make sure that we stay away from each other so that we are not passing this virus from one person to another. And that's a very simple concept. By maintaining that physical distance, we avoid passing this virus from one person to another. If this virus doesn't pass from person to another, then over time period, this virus is not going to prevail. Rather, we will prevail. And it will give us time to come up with testing, with targeted quarantining, with being able to build the therapies that we want. And lastly, we will be able to provide care for every single one. Now think about it. If all of a sudden 100 patients show up in emergency department, it is very difficult for the emergency department to take care of every single person the right way. But if we can slow it down, bend that curve, then patients who are coming 10 at a time, we can take care of every single one. And I can tell you something that you might have heard in the media that a lot of healthcare workers are concerned. I will be honest with you, some of us are scared, but I'm an ICU doctor, and I can tell you about our teams in ICU. We deal with this all day. We deal with sick patients all day, and we are not afraid. But we need your help. We need your help in slowing it down for us. We will take care of each and every patient. We will do everything to make sure that you not only survive, but you survive very well and come out stronger on the other side. But we need your help in slowing it down. And that's what physical distancing is helping us with. That is what all the precautions that are being suggested for public, and again, those might be different in different areas, are going to help us with. And that's where the concept of physical distancing and other guidelines come in.
Thank you so much, Dr. Mathur. That was very, very poignant and important for us to understand. So from just my understanding, again, to reiterate to the community, physical distancing and social distancing is something that we can all practice in order to help you guys as frontline healthcare workers, because of limited facilities that are available if everybody shows up at the emergency room having to go to the ICU. And so we need to be able to protect, especially those higher risk people who are coming and being taken to the ICU and the emergency room as well. And so it's really important to continue to practice social and physical distancing to be able to help with that effort and flatten the curve to help the healthcare system. Thank you so much, Dr. Mathur.
And I just want to make this point that it's not just for COVID, it's for sick patient. We are here to serve and protect and heal every single patient. So we want to do that. It's not just for COVID patients.
Yes, thank you. We should continue not just social and physical distancing, but continue to practice good hygiene practices as well. That goes along with that, I believe, right, Dr. Mathur? That includes, not touching, your hand and making sure you're wearing gloves or wiping down surfaces as well. And so definitely this does extend beyond just the COVID crisis. And it's just bringing attention and awareness to those practices that we should be continuing to develop. Now I want to turn a little bit and pivot over to you, Curtis. According to the latest statistics and figures from the CDC and the WHO, a person's risk of death from COVID-19 increases by 5 to 20% as their age increases above 50 years. And there's a 6% higher risk if a patient has cancer versus not having any pre-existing conditions. How sobering is that realization? And how has the bladder cancer community in your organization dealt with this information to protect cancer patients who are at such high risk?
Well, for me, it's very sobering because a lot of the treatments that, well, what I'm on is immunotherapy. So my immune system is already being compromised. So I'm very concerned about that as far as I go. Now, as far as my organization, Crush It for Curtis Foundation for Bladder Cancer Advocacy goes, we do have a panel of medical experts that sit on our medical board. We right now are just following the CDC and the World Health Organization guidelines, but it is very concerning, to the bladder cancer community, because most of them are on immunotherapy, and so we are encouraging folks to follow the current guidelines. Right now, we haven't really had time to get our medical experts together because this has been happening so fast, and they are extremely busy in their own fields to really put together any other guidelines that are already out there by the CDC and the World Health Organization. So, so that's what my organization is doing right now, is we're just really supporting those current guidelines that are out there, to answer your question.
No, thank you, Curtis. I appreciate your response to that. Cathy, do you have anything to add as well to what Curtis had mentioned?
Yes, I mean, the messages we are getting from healthcare providers is, your healthcare team knows you the best. So if you have specific questions about your experience, contact them. The guidelines are good. The guidelines are changing as even the professional societies are working to meet the moment and answer all the questions. So please reach out to your doctors, and they will give you the best advice for your particular situation.
And just to go off what Cathy's saying too, we do the same thing. We recommend that bladder cancer patients reach out to their oncologist with any questions or concerns that they may have. So,
I would like to add, Arun, thank you, that there's also so many psychosocial concerns, and I know Dr. Benedict will get into some of that, but the isolation and the triggering, that the emotional triggering that this COVID crisis is causing is really of concern. But many organizations like Living Beyond Breast Cancer have peer support and places where people can go to share their concerns, to be in community, because that is so important these days. So that's another piece of this that I know we'll get more into. But thank you.
Absolutely. I'm very excited to get into some of that with Dr. Benedict later on as well. Thank you, Cathy, for bringing that up. Both Curtis and Cathy, thank you for your opinions. It is a difficult time. It's a sobering realization about the higher risk groups, including the cancer community, and what they have to deal with and the extra precautions they have to take. And it is good that the guidelines are changing and that they are coming, even though medical professionals, including Dr. Mathur, are extremely busy. The patients are on the top of their minds. And so we really are, everybody's trying to come together to try to make these new recommendations work and disseminate appropriately into the community. And so I want to touch on what does appropriate information really mean, and kind of throw this out there because there's a lot of misinformation going around in the popular social media, which some experts say is actually deadlier than COVID-19 itself. Curtis, have recommendations from professional societies such as the American Urological Association been helpful in addition to the CDC? And in this age of information overload on the internet, how can patients and caregivers get accurate information from a central resource and a trusted resource?
Well, to be honest with you, I have kind of stopped paying attention to what's going on the media because I just feel like they are putting a lot of misinformation out there. They're contributing to it, I believe. they're making, I think, the situation worse than what, I mean, I know it's a bad situation, but I just stopped paying attention to the media on the news, and just really focusing on the current guidelines that are out there. Yes, you know, they're changing, and so I try to stay up to date with that every day. I have not seen, or I can't put my finger on it right now, if the Urological Association has released any guidelines. I'm sure they have. But I'm just not sure, you know, I don't have those in front of me right now, but their guidelines are, I'm sure their guidelines are helpful.
Yeah, and I think one takeaway that I got, which was helpful, is that, you know, the media sometimes tends to sensationalize things and focus on the negative and a lot of this misinformation. It might be helpful to tune that out a little bit and refocus what we're really focusing on. And I'm certain that your organization, as well as Cathy's, is trying to give appropriate information, safe information, and vetted information.
Oh, yes. We
Yeah,
are.
please go ahead, Kurt.
Oh, I was gonna say, oh yes, we are definitely trying to do that. You know, it would definitely be nice to hear some positive things that are going on with the COVID virus, you know, things, you know, where the kind of the curve is coming down somewhere, or just hear some positive things about COVID rather than all these negative things that we hear every day that I believe really take a toll on us mentally when we're already in isolation. So it would be nice to hear some positives.
Absolutely.
Yeah, I have one thing.
It's important. Yeah, go ahead, Dr. Mishra.
Yeah, I have one thing, Curtis, regarding your inquiry of. So there was one about the using immunosuppressants. So this was a study done in China, Wuhan, China, which was, of course, was the epicenter. So, you know, everything would be kind of done in that context. But the study recommended that please avoid treatments causing immunosuppressions, or to have the dose decreased. Actually, that's what so it's a published study. It was published in Annals of Oncology. So it's so that's the one thing that I could find. Hope that helps you.
Mm-hmm. Sure.
Thank you so much for that, Dr. Mishra. I'd like to continue that conversation with you, Dr. Mathur. With the misinformation going around, it comes in all forms, not just in what you can do to prevent getting it from simple things to more complicated things. Just to give you an example, chloroquine, an anti-malarial, was being examined as a potential treatment for COVID-19, and I know there have been some clinical trials that have been started. However, interpretations in the media have led, actually, unfortunately, to some individuals attempting to take it daily in order to prevent coronavirus, actually with fatal consequences. What suggestions do you have to the patients and the public who are anxious, want to help avoid getting sick with COVID-19, and where they should turn to for information?
Yeah, I think it's unfortunate, you know, and I think it's a lot of evolving situation. As physicians or healthcare or workers, we are also ourselves learning and relearning every single day. And some of these are not necessarily incorrect answers, but we just don't know right now. So that's why a lot of trials are going on to figure out. And unfortunately, when you are early in a pandemic like this, you don't know which is the most effective treatment till we try it out on a few different patients, and we know for sure that this is going to help. And again, we are here through American Association for Precision Medicine. We have to realize that not one treatment is going to work for every single patient either. So we have to individualize therapies, just like we individualize therapies for cancers and different cancer patients. And also, it may not just be one solution, it may be multiple solutions that we might be able to create and be able to prevail. I think the best approach to this is to stick with your healthcare provider. And while the hospitals are overburdened, while the hospitals are restricting, different entry points over there, but I can tell you, most of the healthcare systems have now evolved to be able to virtually connect with you and be able to provide you with guidance and therapies. So best opinion that I can give you on this is to connect with your healthcare provider who knows you well, or at least who can look through your history and background and be able to give you precision guidance in what will work for you or what will not work for you. I'll tell you something, we are all scared, right? We are all scared about what's happened and what's happening right now. But I want us to take a positive outlook in this. One, a virus infection is not new for us. We have had multiple virus infections. And I'll tell you, some of the virus infections like Ebola and others have been much worse. Those are like much deadlier viruses, and we have prevailed. This has brought the entire world together. If you see the amount of research that is going on across the world, everybody joining hands and sharing information in a rapid cycle, people, that is the healthcare providers, are not worried about publications. They are not worried about keeping the innovation to themselves. Right now, everybody's sharing information. Unfortunately, when everybody shares early information, we don't know which one is true or which one is not. And that's where we are all coming together to make sense of that too. But everybody has joined hands right now across the globe to create the best possible therapies and prevention strategies for our patients. And we will come out of this very strongly. Unfortunately, the first quarter has been rough. And I know, but we need to maintain a strong defense right now. Just hold the line, just maintain that interpersonal or social distance for now. Follow the basics that we know about for prevention of these viral infections. And I'll give you a very simple acronym for this that I created. It's PROSPER. I wanted to keep it positive. I don't want us to be afraid. We cannot fight this virus through our fears. We can only fight this through our innovative thinking and collective genius. So think about PROSPER. So P stands for protection, doing your hand hygiene, maintaining your environment clean. R stands for relearning. Relearning because we have forgotten a lot of basics, and I think we need to relearn those basics. O stands for organize. Organize yourself. If you're afraid, as Dr. Prasoon Mishra was saying, our senses shut down. This is the time for us to organize ourselves well. I don't want to miss my medications. I don't want to miss my therapies. I don't want to miss the guidance that is being provided by my healthcare provider or others. S is for social distancing, which we have already talked about. P is for physician or healthcare provider guidance. I already mentioned that. E is for exercise. Whether you do yoga, whether you do any other exercise, continue to exercise yourself well and stay fit, because that's going to help you. And R is for resilience. Don't worry about the numbers that are being portrayed out there. For you, think about what you need to protect yourself and your community. So R is for resilience, and we will come out stronger out of this.
I love that message. Thank you for putting a positive spin in that. PROSPER. Please remember that acronym, everyone, and share it with your communities. That's a beautiful message. And I like also that you mentioned that in this time, even though people are anxious and worried, they have their healthcare professionals to turn to for accurate information in this age of information overload and things like that. So I really appreciate that advice that you're giving all of us, Dr. Mathur. Now, one thing that you brought up that I was kind of reminded about was we have experience with previous outbreaks, some of which are way deadlier in terms of the consequences. I remember being a medical student when Ebola came out as an outbreak, and it was a scary time. It was scary because we understood, even in medical school, how patients are affected by that. And it was scary because I remember our school was grappling with, can we extend the limited liability insurance that medical students are being given as to whether we can interact in clinics and emergency room settings and things like that. And so I know we also had the SARS outbreak as well, And we had important lessons that we learned from some of those. And so I'd like to turn it back over to you, Cathy and Curtis. What kind of lessons have we possibly learned, do you think, from those that we are applying and that you guys are applying in your organizations?
Well, the trusted information piece that Dr. Mathur and others have voiced is truly important. We're learning so much about this disease that it seems very chaotic. So I am not sure I'm actually hearing what have we learned from past pandemics. At the moment, information does seem chaotic. And that is why I am heartened that the professional societies and then individual doctors are stepping forward and guiding us through this, because this seems different. This is affecting the entire world, not just different pieces. I think people turn off sometimes when it's not in their backyard. This is in everyone's backyard. And I think we are paying attention in a way that we have never paid before. So also, Curtis talked about shutting the media out. I think sometimes that is the best and healthiest response to all of this for cancer patients and for everyone. But we have to listen to the messages that are trusted. And I think that is, for me, that is the most important. And we are one organization that is evidence-based and but informed by our patients and people who are impacted by the disease. So balancing the internet and all its positivity with some consumer savvy is really important.
Yeah, I mean, the same here is really just, looking at that trusted information. I'm in Virginia, and just recently, surprisingly, we had some really nice weather, and people decided, hey, we're going to venture out to Virginia Beach and, enjoy the beach. Well, it's like, we have this COVID-19 going on, social distancing. Why did everybody decide to go to the beach? And so our governor had to put in place mandatory stay-at-home orders, because people just were not listening. I don't know if I'm not going to say that they're not listening now. They may be, but I still see a lot of people going, out and doing things. I had to go to Target the other day to pick up some medications, but I only went out to do that. It was very scary as well to do that. But I think, just listening to that trusted information that's out there and listening to the doctors that are on the front lines, because, things are changing it's changing like every second, it seems like, almost, but definitely every day.
Yeah, thank you so much for sharing those perspectives. Really do appreciate it. Dr. Benedict, I had a burning question even from last time, and so I hope you don't mind. I'm going to ask you a quick question to chime in here. Patients who are being affected by COVID-19, whether that be on cruise ships or out in the community, find themselves apart from friends and family, cut off from work and activities, sometimes confined to a single room for extended periods of time. And sometimes, if they're in healthcare facilities, their only visitors are healthcare workers wearing head-to-toe protective gear. What measures are being taken for the mental health of these patients when their fundamental issue is a loss of control and isolation?
Yeah, thanks for that question. What measures are being taken? I think that last week we talked a lot about things that individuals could do themselves without, with the analogy of put my air, if in a plane that's going down, put my air mask on first and take care of myself, and that doesn't require anyone else around you or a social interaction. But at the same time, we're social beings and we want to be close to the loved ones. I'm fortunate in terms of finding reasons to feel grateful in this time. I'm fortunate for all the technology that does exist. It can be a source of overwhelming information, but it can also be a source of creative ways to connect with loved ones, to feel still connected to the outside world. At the same time, so my expertise is in psychology and connecting with patients one-on-one. And we have quickly, at the drop of a hat, moved everything to telehealth. So as Dr. Mathur was saying, everybody's coming together, the entire medical community is coming together to try and best treat and support our patients. So I've been happy and optimistic that we are making positive steps in that direction to connect with patients, to make sure they're still getting the support that they need. So yeah.
Wonderful. Thank you so much for that. I hope I didn't put you too much on the spot there, but really thank you for that perspective about how we're all trying to come together for patients in this difficult time. I really do appreciate those thoughts. Dr. Mathur, I'd like to turn it back over to you. If you can talk a little bit about how experts around the world are coming together to solve this, and what are some unique diagnostic and therapeutic solutions that are being explored. And some of the questions I'm being asked is, why is it taking so long to get a good diagnostic test or a therapeutic treatment or a vaccine approved? Could you comment a little bit about that?
Yes, I think it's a challenge because first of all, we are trying to treat everyone, and it's not that the other diseases have gone away, right? Patients still are developing cancer. We still have to treat cancer patients, and we have to do it the right way. So those challenges are still there with us. And then on top of that, this is a new pandemic challenge that has been imposed upon the healthcare systems. And that's where people are uniting. They're sharing information. They're creating all these data sets and databases where we can collectively look at the information. I'll tell you, I've never seen this come together so quickly. I mean, we might think this is taking forever, but if you think about in 2-3 months to develop like new diagnostic tests and to put them out there, it doesn't happen that rapidly. So yes, for a lot of patients, for a lot of us, it's coming too late, or it's taking time. But trust me, this is working at a pace that we have never seen before. What are some of the people in healthcare doing? Well, a lot of organizations have joined hands together. So when we look at the critical care societies, a lot of critical care societies have joined hands together. And they are looking at all the information collectively. And it's not just the societies in one particular area, like in US, but US and China, US and India, and a lot of us are in EU. We are learning from each other continuously. So yes, it might seem that it's taking a long time, but there is a process to this. You know, we have to learn about the virus first. And I'll give a lot of credit to not just the healthcare workers, but the non-healthcare researchers who are spending enormous amount of time in supporting us. I want to give a lot of credit to the industry that is building these products so that we can put those out there and then be able to test them and trial them. It's a collective effort, and it's a collective genius that is truly coming together to fight this virus. So in the time course of things, I think the pace of evolution and innovation is truly phenomenal. But yes, I would like to have a switch that I could turn and say like, okay, here is the therapeutics, or here is the diagnostics for this, and everything is over. I think it requires us to be patient, and it requires us to organize. Remember the prosper, organize. So we need to organize ourselves in trying to understand what sources of information am I going to look forward to. It requires us to organize our day. It requires us to organize ourselves and prepare ourselves so that as these diagnostic and therapeutics come online, we are prepared and we are ready to go on board with them. I can't give you like a single answer Like, why do these things take long? These are complex processes. These require reliable testing. You can't just put out therapies. Sometimes when that has been done in the past, we have learned that those therapies have caused more harm. And the first oath that we take as healthcare providers is do no harm. So we have to do it the right way.
Thank you so much for breaking that down, Dr. Mathur. It was a great message about how we're all trying to come together to create these new diagnostics and therapeutics, and how usually it takes much longer, and we're accelerating that process as quickly as we can. And that acceleration takes not just the healthcare workers and the clinical researchers, but it takes industry coming together, pharmaceutical industry, non-pharmaceutical industry, all of these collaborations. And that's what truly excites me, is the academic industrial nexus, where ideas are generated and then translated into unmet patient care need, in this case for COVID-19. So I do really appreciate that perspective. Now, some of the things that you mentioned in there, I'd like to follow up with about data and how we're trying to analyze the data, and the importance of establishing good data that is there in a central repository that can be openly analyzed and shared. Now, there has been a little bit of an issue with data sharing around concerns about patient privacy and things like that. And so, Cathy and Curtis, I'd love to hear your comments, because we in the community, in the research community, really want to try to establish a data repository so that everyone can quickly analyze this information, especially in the setting of a pandemic. What are your thoughts about that?
Well, I will just say there are many patient advocates who are very involved in patient registries and donating tissue and blood samples to reach a cure for metastatic breast cancer sooner. There are a variety of things going on that patients are very interested in. So I think engaging the patient community in these clinical trials, establishing trust, discussing the privacy issues because they are real, and then energizing the community. One thing that we have been seeing as an organization that trains patients to be advocates is an increasing involvement in attending the big meetings, ASCO and the San Antonio Breast Cancer Symposium. Patients want a seat at the table, and they want to help, and they want to be asked, and they want to give their expertise. So I think this is a beautiful moment to really be asking them to join these sorts of efforts. And I think you'll find a very willing audience. Patient privacy is important as well, but people are really willing.
Yeah, and I will say that, patients, patient privacy is very important as well, but they are willing to be at the table, and I think that they want to be at the table. I've just recently given some presentations to some pharmaceutical companies to be able to actually put a face to bladder cancer, because they're doing research on how to improve clinical trials, and they want to actually make it more human than just the pharmaceutical reps, going and presenting their information to the doctor, but they want to humanize it more. And I also sit on the congressionally directed medical research program as well, and have input on grants that researchers are submitting for bladder cancer, which there are other patient advocates who can also participate in that. But I think definitely involving the patient in this research and clinical trials, I think is definitely the forefront of research and collecting this data. I've even been willing myself to participate in some additional research projects, just because I am so passionate about trying to find more treatments. You know, I usually say I envision a future immune to bladder cancer, and I truly would hope to one day see that. I don't know if it'll happen in my lifetime or not, but I'm willing as a patient advocate to really donate my time to anything that is going to bring value to the bladder cancer community in advancing that research. So I think definitely involving the patients is very, very important.
Yeah, thank you so much, Curtis and Cathy, for sharing that. I think it's extremely important to involve patients as a seat at the table, especially because the data that we're talking about, it really is patient data at the end of the day. Now, in terms of privacy, there are different issues obviously surrounding security of data, but if data is appropriately de-identified, then my feeling among some of the experts in the community as well is that it should be appropriate to be placed in a central repository and open source so people can quickly access it and analyze it, instead of having individual data sharing agreements, which take a lot of time, and there's a lot of difficulties surrounding that. And I think it's really important to have patients and patient advocacy groups also involved in those discussions. Now, I want to touch a little bit about what you said, Curtis, about clinical trials and the importance of clinical trials. As a clinical trial specialist, I can tell you that clinical trials and continuity of clinical trials are severely impacted as a result of the COVID crisis in terms of new patient enrollment, which can be halted, or ongoing patient visits in clinical trials. And in addition to that, some of the early phase clinical trials, compounds that have never been tested in humans before, you need to be very careful about that, and that's why they do safety studies. But with those safety studies, especially in the cancer community, a lot of those clinical trials take tremendous patient burden, is what I'm understanding. We're asking a lot of patients. We're asking for them to come in and give significant time. We're asking for their caregivers to help take them to visits and care for them. We're asking for inpatient admissions and weekly outpatient chemo infusions. This can impact not just the patient's financial security with their jobs, but also their caregivers and the finances that they're exposed to, things that we in the professional community call financial toxicity. And especially in this COVID crisis, that can be further impacted as well. What are your thoughts about some of those impacts and what we can do to make these trials a little bit more patient-centric to lower the patient burden?
Is that directed to me? Or
both Curtis and Cathy, please feel free.
Okay, all right. So I will just say that when I participated in my clinical trial, the sponsor wasn't really willing to do much for me. It was more about what I can do for them. My clinical trial nurse actually had to kind of negotiate with the sponsor to at least cover my night stay in a hotel, because I was required to be in the clinic sometimes once a week, sometimes 2 or 3 nights during the week. And I live 2 hours away from the cancer center that I go to. So it was very, it was very costly to travel back and forth as well. So I think, like I said, I recently, one of the new things that I think a lot of the pharmaceutical companies are doing is they are engaging the patient now to find out, how can we help with that toxicity? Is it, that we can help cover the gas? Is it that we can help, cover the food? Can we even maybe, give you a stipend every day? So I think that they're looking at other ways to help with that financial toxicity. I mean, let's be honest here. I mean, they're making millions, if not billions, off these drugs, and we're giving a lot, as patients. So to compensate us for our stay or our travel is just a drop in the bucket for them. I mean, so I think things are changing, hopefully. And I hope that patients, I also advocate for patients to be aware of these things. If you're going to participate in a clinical trial, look at how you're being treated and what you're getting compensated for what you're giving, because you're giving a lot. I can't even tell you. But on the other hand, it's also very rewarding to participate in a clinical trial if you're able to, because you are potentially changing or could be bringing a new treatment to the forefront. But it does take a toll on the patient very much. And so these pharmaceutical companies do need to be really looking at how to compensate patients better and take care of the patient better.
Great. Curtis really pointed out some really important things about financial toxicity and what pharma can do. And I have to say, I want to say there's been some progress being made in clinical trials and with patients really achieving some notable successes. So there are a couple things I want to point out. There was a recent trial of breast cancer drugs that involved, the clinical trial from the beginning involved patients with brain metastasis who have long been excluded from many of the trials. And that was so important to the metastatic breast cancer community and such a breakthrough. And it feels like a real win for breast cancer patients. In addition, men have often been excluded from breast cancer trials, and men are diagnosed with breast cancer about 1% of the time and are an important group to attend to. So that is starting to loosen. The financial toxicity that Curtis discussed also is an issue that we've been in discussion with our pharmaceutical partners, because just because clinical trials have not been able to find a way to pay for transportation, to pay for childcare, to pay for the caregivers helping, these things are under active discussion now. So there are so many important ways that patient advocates can influence and make clinical trials more effective. In addition, one of our partner organizations, Tiger Lily, is working with African American women to get more people involved in clinical trials. So that's a voice that has not been heard and a population that has a very low participation rate. So these are just some of the ways that patient advocates are really stepping up, stepping to the table, demanding in some cases to be included. But the benefits are real and they're important.
Sounds good. Thank you so much, Cathy, for that insight. I think Dave wanted to mention something. Please, Dave, chime in as well.
Thank you, Arun. Yeah, what Curtis shared is really powerful, and I wanted to speak to the challenges and the burden in participating in trials. My heart aches as a patient and caregiver for the things, the burdens that we face. Also, as a researcher, being so familiar with the regulatory process and ethics review boards and, how much we have to be sensitive to in the clinical trial process, it's painful that oftentimes we want to but can't do more, or have to respect a process that for an overall population does more good than harm, but that there are individual aspects of that can be really difficult to understand. And, living on both sides of that fence, both as a patient, as well as a grieved son, who lost his father to cancer, and as a researcher, balancing both sides of that is incredibly difficult. And, Dr. Piyush, I heard you say, how much we're in this together, and coming together is helping things move at a speed that they never have before. and I truly believe that when we have open conversations to see from both sides, we can do things that, just as a patient or just as, a scientist or a researcher, it's almost impossible to see all of the impact across the entire system. So I'm just grateful that we get to share all of these perspectives, because together they're the only way we really change and remove some of these difficulties. Thank you.
Yeah, thank you so much, Dave, for that. Curtis, Cathy, and David, really appreciate your insights as we're in challenging times, not just in general with clinical trials, which are a real avenue of potential treatment for cancer patients and patients at large, but also clinical trials in what's going on in the current COVID crisis. And I encourage all of you in the patient community, if you're having issues with some of these clinical trials, not just to reach out to your providers, but reach out to these patient advocacy groups, because they will have great additional resources to be able to help you for those. Now, I can tell you from my perspective, things are changing. Things are changing in clinical trials to try to adapt. There has been a concept that really is being explored actively right now called decentralized trials. And what they're trying to do is make a digital visit similar to telehealth visits for your provider, but really try to do all of these visits as much as possible to reduce patient burden and reduce patient risk of exposure by providing opportunity to do some of these trial-related activities from the comfort of your own home. Now, this is being explored actively by major pharmaceutical organizations, clinical research organizations, and academic centers all across the country and across the world. This technology had already been talked about for the past couple of years, but in the scope of this current pandemic, it's being put into action right now, and they are exploring how to put it into action into various trials to continue to give those to patients as an option. And so with those new technologies, Dr. Mathur, I just want to pivot to you and ask you a question about how your experience has been with the American Association for Precision Medicine in terms of the task force that you're a part of, including your interests in data science, and broaden that a little bit about some of these new technologies and how we're trying to adopt and adapt to those technologies, all the way from telemedicine visits to companies exploring smartphone apps, wearables, drones, almost as a digital revolution in this effort for precision medicine in healthcare and clinical research. And will this pandemic in its scale push us to adopt these technologies in these professional settings that we've been resisting adopting before?
I think that's a great question. I think AAPM is at the forefront of this, bringing everybody together. And, we have been talking about like patients and healthcare workers and all, but this virus is uniting us together as humans. And I think that's one of the most important things. And at this point of time, it's hard for us to know, as I've said before, which treatment or which preventive measure will turn out to be the most successful one. Now, there are certain things like the social distancing or physical distancing that we have learned about, but I want you to give you a little bit different perspective. This coronavirus is novel, but not that novel. If you go back a few years to SARS epidemic, it was more localized to the Asian countries. And that was pretty much the same coronavirus up to like 90% of its genetic structure and all. And those countries learned how to deal with it. That's why if you see things like the temperature checks, which have been routine over there at many locations, they have existed for a long time over there. The reason why they are able to track the data very well, the reason why they are able to leverage mobile resources very well, the reason why they are able to look at thermal scanning very well is because they have been dealing with this for years together and they've been prepared. We on the Western side or in many other countries have not dealt with SARS. So we were actually not ready or prepared. So there are a lot of lessons that we are learning from those countries who have faced similar epidemics in the past in context of this pandemic. Now, truly some of these applications could not be or cannot be applied at like as fast as the pace we would like to. But the governments have recognized, the healthcare workers have recognized, the organizations have recognized that this is not the time to create barriers. This is the time to put these applications in place, recognizing, being respectful of patient privacy, but at the same time, trying to harness the data that we need to. And there are a lot of different organizations. You look at examples of Google, you look at examples of different data companies which have provided applications which are harnessing a lot of information and in rapid cycle convert it into meaningful information so that we can use it and track the disease spread and things. So in many ways, this is something that we a little bit know about from the past. It's a pandemic that is overwhelming all of us. There is a lot of innovation that is going on in the healthcare place. I shared some things with Arun, rather he had brought it to my attention. We are developing newer tools to protect ourselves, not just the healthcare workers, but also the patients. Something that would not happen in such a collective way. And I want us to think about all of us, not as patients or healthcare workers, but spend your energy not being afraid and not being fearful, but think and organize yourself in finding a solution that will preserve each and every one of us. Now, that solution might be as simple as, this truly helps me remain calm, and sharing that with everyone else is very important and meaningful. Because if people panic and they all are doing things which are not going to help us, then we are all collectively going to get harmed. Just simple things, but that I want us to harness that collective genius within each and every one of us. And I don't know which is going to be the most impactful solution. If you think about currently, which has been the most impactful solution? It's not been a drug, it's not been a device, it's just been physical distancing, which is a concept, right? I'm sure you all have an extreme amount of genius to come up with these concepts that we all can utilize to slow down this virus spread, to prevent us from getting it, and to treat it. I don't know which tool or which device you're going to create next that will protect all of us. So think about that. This is something in which all humans are together.
Thank you so much, Dr. Mathur. And I think you are talking about the collective genius in all of us and how we can all come together at this time to do something, to either that be research on something, or connect somebody with something, or connect some resources to people who don't have those resources. And I think that's really powerful. And I want to touch upon how you also and your organization and some of your connections are exploring different creative solutions to tap into that creative genius. One of the things I read about is how anesthesiologists are coming together to create what's called a little box, a protective box for themselves. Because, you know, as you're intubating, preparing for surgical procedures in the ICU and things like that, and you are really kind of getting down in there, even with your mask. Can you talk a little bit about some of these creative solutions that different people are trying?
Yeah, and if you so the example that Arun is mentioning is essentially a plexiglass glass frame, which can be put on over the patient's head, so that when we are trying to put a breathing tube into the patient's mouth who has this virus, the healthcare workers don't get exposed to overwhelming amount of virus. People have tried different plastic sheets and drapes, because if the healthcare workers get infected, as you know, they may not exhibit it right away. First of all, it takes them out of the work group, but they also might transfer it to other patients, and that's what we don't want happening. So we have created these innovative solutions in no time, and we are not restricting ourselves in sharing this information. Very quickly, these have gone to YouTube videos. And a lot of people are looking at these videos and saying, oh yeah, that looks interesting, maybe we should try that. And then all of a sudden it spreads like a wildfire. So I don't know which one of those ideas is going to save 100,000 lives, but I know it's going to come out from us, which is going to save a lot of different lives. Similarly, if you look at the N95 mask, Now, N95 masks are these masks that are supposed to limit the amount of viral exposure from a patient to the person who's wearing it. And this has been immensely helpful for healthcare workers. But there have been, the amount of N95 masks has been limited. But there are a lot of companies, there's one in Ohio that has come and figured out a way to reprocess these masks and make them available to us again. So all of a sudden, that reprocessing increases the availability of these single-use masks for every single healthcare provider and others to be able to protect. So that's why these ideas are extremely important, and sharing those is extremely important, because we are learning a lot from this. So these are like a couple of examples. Similarly, if you look on the data science or artificial intelligence or machine learning side, a lot of models are being built right now, and they're looking at a lot of different considerations to understand this viral spread and what's working and what's not working. A lot of innovation going on in space. But again, you all have that collective genius. We need to get those ideas out, try those out, and see which one helps each other.
Thank you so much, Dr. Mathur. It's really important about that message about the collective genius, the ideas we're trying, the ideas that you're trying with your colleagues as well. Everybody's trying different ideas, and let's see what sticks and let's see what works. I like the positive message there. I want to touch upon, as we're transitioning, I want to give the audience members a chance to really ask their questions and participate. There's one question that I saw, and I had this as a question of my own, kind of predicated because our task force was affected. One of our members in our task force, unfortunately, they lost their grandfather in Spain. It was a very quick and rapid demise, unfortunately, and they were brought in by a caregiver. And so everybody is affected by this in some way, whether we know somebody or we're personally affected. But in terms of what precautions we can take, I think I saw some audience questions about masks. I know there's different types of masks. There's standard masks, there's the N95 type masks. Some people are doing do-it-yourself projects and stitching their own masks as well to try to bolster resources. Should everybody be wearing a mask, Dr. Mathur? I know that we don't have enough masks currently going around. How are healthcare workers protecting themselves? And what are your thoughts behind who's really being helped if the public is wearing or not wearing masks?
I think that's a great question. And I think this is also something that is an evolving science. So we are learning constantly about how this virus spreads. We still, as of now, understand that it is a droplet spread. So what happens is that this virus is essentially in a droplet. And most of the times this droplet cannot go that far because it becomes heavy and it drops down. So most of the times it can spread. But there are some instances which have come to attention where it might be able to go further than what we thought. And those are like somebody's coughing or sneezing or in certain other situations. So that's where some of the concerns are, that should everybody be wearing a mask? Should just the healthcare providers be wearing a mask? And put it in context of the shortage of masks, it creates a different set of problems. What I would say is right now, you should follow the guidelines that exist, either from CDC, from the different national organizations, whichever nation you are in, or your local organization. That might be your state, that might be your healthcare organization. Follow their recommendations and guidelines, because they are putting the best effort and the best recommendations based on all these different contexts together. Now, there are two different things that these masks do. The masks that the healthcare providers are wearing are there to protect them from getting an infection. My rough estimate, which I have seen some data, again, it's early, is that if a clinician like myself, who's an ICU doctor, gets infected and is out, probably I might, before getting out of service, I might infect a few other caregivers. If a lot of us are out, trust me, a lot of patients are not going to get appropriate care. So that's why we are using this N95 mask. We're using all these precautions to make sure that we are available to serve all our patients and their needs. And it might be COVID patients, it might be non-COVID patients, and it might be cancer patients. The masks, which are the ones that are made out of cloth or otherwise that are being suggested and recommended for population in different areas, essentially prevent the spread of this virus from an individual to rest of the population. So it's not to necessarily protect that individual. It might offer some level of protection from others, but the primary purpose of that mask is, say, if you are infected, as you're speaking, as you're coughing, as you're sneezing, as you're not realizing the different aspects of this spread during your day-to-day activity, you don't spread this elsewhere. You might be going shopping, you may not realize that, as you are talking to somebody, something might go onto some thing in your environment. So that's why those masks are being recommended in various different places, so that you can protect others. It's not necessarily just for yourself. So two different aspects. Follow the recommendations which your organization, your country, or your state is providing you.
Thank you so much, Dr. Mathur, for sharing about the different types of masks, why we're trying to get masks and wear masks, why healthcare workers need to wear a specialized type of mask for further precautions that they're taking. It seems to me definitely that there's also some asymptomatic carriers. And so with those asymptomatic carriers, probably that's the best population to target to ensure that they're wearing masks. But my feeling is that if they don't have those masks, because masks are in short supply, then that's where that additional social distancing and self-quarantining comes to play. But we shouldn't forget, regardless of whether we have a mask on, to still practice social distancing and still practice personal hygiene, because there shouldn't be a false sense of security just because we're wearing a mask that we can forget about all of that. Could you please comment on that as well?
Yes, that's 100% true, that just wearing the mask, because we know that this can spread through contact too. So if you sneeze or you cough, you get it on your hands or some other places, and that gets transmitted to another person, that is equally harmful. So the mask does, in certain situations, help protect the spread, but it does not take away from the basics of personal hygiene, the basics of maintaining that personal distance. So if you say, for example, if you're 15 feet away from somebody, even if you cough or sneeze, it's extremely hard for that material to go on to that person who's 15 feet away from you. So that still is an important level of protection. You still have to be cautious about washing your hands all the time. So if something gets on your hands, we know we touch our face all the time. Probably I already touched my face 2 or 3 different times during this webinar. But if we are touching all these things, we should make sure that we wash our hands so that we don't contaminate the areas around us. And that's why I go back to the basics. And I try to put a positive acronym to that is PROSPER. And this is the P over there, the very first one, stands for protect. That is hand hygiene, it's cleaning your environment and following the basic personal hygiene disciplines.
Thank you so much, Dr. Mathur. Just one final question from my end, and I really want to turn it over to the audience as well. And this is a question that I think is really important. Please, all of you on the panel, please contribute. There's a discussion, as we've had, about social distancing now reinforced as physical distancing. How do we appropriately socially distance from people without emotionally distancing ourselves?
Yeah, I think that's a great question. We still need to stay connected. I think we're learning new ways to stay connected, just like on this webinar. Previously, we would be having like physical meetings. I think we need to provide emotional support to each and everyone. These are very trying times. And I take care of a lot of cancer patients, and I can never be in their shoes and try to understand what they go through day in and day out. So don't try to judge other people. People will react in different ways because this is a scary time, but provide that emotional support to each other. Be considerate to each other. If somebody is making a mistake, watch out for them and in a polite manner, try to correct them. I think that's what we need to stand for. These trying times will go away and we'll come out stronger through this.
Yeah, I'll just jump in. I think, the connection piece is so important. I've heard of even a daycare class was being connected by Zoom with their teachers, and the children's faces were so happy. We need to remember not everyone is connected by technology. So pick up the phone for some people, let your neighbors know what's going on. I know the patient advocates are reaching out through social media, but I just want to do an old-fashioned reminder about the phone.
Yeah, and to jump in, and we'll be picking up on this more when I talk to our guest speaker, Swamini, but a lot of what happens when we feel negative emotions, such as fear and anxiety, that's kind of those are the emotions that lead to feeling socially distant from our loved ones, or not being able to feel the positive effects of being with those around us. So again, to be able to manage how we're feeling inside, to then let in those feelings of being socially connected, particularly in the more creative ways that we're finding today, and to find joy in those connections, I think is important.
Chris, do you have any final comments regarding that?
No, I don't. I agree, both with what Cathy and Dr. Benedict said about keeping those connections. I guess one thing that I really do as well during this time is I really connect with my friends that have cancer, because they understand and know, what I'm going through during this time. I mean, my friends that don't have cancer, I mean, they know the medical piece and, all of that we're going through. But when it comes to cancer, I'm really, and during this time and I'm really connecting with my cancer friends during this time, whether it's through virtual texting. We do pick up the phone and call each other once in a while. A lot of times I will say, I'm just tired of texting, just pick up the phone and call me, or I'll say, I'll just pick up the phone and call them. So I think definitely, keeping those connections is very important. So.
Thank you for sharing those thoughts, Curtis, Dr. Benedict, Dr. Mathur, Cathy. I really appreciate that. Audience members, thank you so much for hanging with us. We've tackled so many different issues today, all the way from how to deal with COVID, what does it mean, what are the new therapies and diagnostics and technologies, patient advocacy organizations as resource groups, clinical trials, data sharing. All of that is really, really good stuff. And now we've gotten into emotional support resources as well. Now, I know that you guys in the audience have a lot of questions, some of which have been in the Q&A, and I love to see that. I know Ben from Grid Health wanted to lead some Q&A, so I'll turn it over to you, Ben. Please do have the audience participate as well.
Hey everybody, so we want to try something out with you guys because, this whole thing about being stuck inside and this social distancing thing. So we wanted a little bit more interaction with you guys and just the question answers. So if you have a question you'd like to ask to a specific panelist or to the panelist in general, there should be a raise your hand button down at the bottom panel there. And if you want to just click that, I can see someone already raised a hand. And what I'm going to do is I'm actually unmute you. You won't be on video. But we'll actually hear your audio. So we're gonna go ahead and try this. So if you have any questions, and please direct it either to one of the panelists or the panelists as a whole. So here's the first one, and go ahead and tell us what you think there.
Thank you, panel member. This is Raghuram Salakanu. I'll just keep this short. I come from an interdisciplinary and like cross-cultural academic background, you know, with like a lot of multinational experiences. And I have an advanced degree in integrated science and technology. My question is more concerned on the policy side of the initiative. So what I anticipate in the future is, so this initiative, assuming it is going to reach a successful conclusion, what kind of response can we expect from big pharma and, you know, the problems revolving around big pharma? So like, are we going to be allowed, you know, are we going to be suppressed, and that kind of issues? Secondly, so if that is the case, are there any measures that are being taken already on within this initiative to work in collaboration with big pharma, you know, parallelly to like meet both party interests? And third and final question would be, what steps are being taken to ensure that the efforts, like assuming again that we are successful at some point in time, what efforts would be taken to ensure that low cost, this is of course, we're interested in providing low cost care to, like, you know, reach equally to all people of all levels. So what steps can we take to ensure that that remains in the future? With that, I'd like to return control. Thank you.
Thank you so much, Raghuram, for presenting that question. Just to reframe, and I'll direct it to you, Dr. Mishra, if you can, just to start. Just to reframe, I think Raghuram was asking about how the industry and big pharma is working with different organizations and collaborations and healthcare organizations and private organizations as well to develop these strategies and treatments. And also, in addition to that, in terms of the cost of these treatments and therapies, possibly if you can touch upon how we are exploring repurposing older medications used in other conditions in this current scenario as well. Thank you.
Yeah, thank you for that question. So yeah, I think so AAPM has a very big collaborative base. So we collaborated, partner with a lot of big companies, pharmaceutical companies, tech giants. So we have folks are aligned at the table. So it's basically act as a collaborative effort, not only just the pharmaceutical companies, but investors, advisors from a variety of interdisciplinary fields. They're coming together. So yeah, that's the answer to that question. And the second one was, I think, the cost, right? Yeah, so the cost is directly proportional to the, you know, what is being invested in and that's a different scenario. But, you know, I can assure you that nobody's trying to make any money this time. Everybody's trying to help. So that's one thing I can assure you. All the companies have given, you know, just to give you an example, the compassionate use of remdesivir is, you know, like almost thousands of people have been treated, and this is just your physician request. So, you know, everybody's trying to help, you know. So I think cost will eventually take care of itself. And there are some other drugs, hydroxychloroquine, that's now tried in New York, you know, and we'll see the results will come. But that is pretty inexpensive drug as well, if it works and shows promise in the clinical trial.
Yeah, thank you so much, Dr. Mishra. Just to clarify, one of the drugs that was mentioned, it's an anti-malarial agent. And so one of the strategies being employed, and please chime in, Dr. Mathur and Dr. Mishra, if you'd like to add, is instead of reinventing the wheel all the way from the very beginning and developing new drugs, which are being tested and experimented and researched right now, are there other older medications that are still cheaply available and readily available that have worked on similar conditions to COVID that we can repurpose and try to test as strategies? And one of those that is being examined is these anti-malarial agents.
Yes, that's true. So instead of just trying to create like new drugs, there are a lot of drugs that we understand about very well. We understand their safety profile very well, and they are being trialed out. And it's not just hydroxychloroquine, but also many other drugs, many antimalarials, many other agents, as simple as the vaccines like BCG is also being trialed. So all the way from the medications that we have used in the past to fight malaria, which has shown some promise, to antivirals, to certain vaccines or repurposing certain medications are being trialed and tested, or even being re-engineered or redesigned right now. Again, we have to be cautious about it because we don't want to be put out like a false hope. And we don't want to put out a product out there and start giving it to patients, whereas it may not work. So that's why we have to be patient about going through the appropriate trials to look at the efficacy and the safety profiles. Of course, the ones, the drugs that we understand safety profile very well, those can be put out there much faster. We're going to make sure that those drugs or vaccines are efficacious. I completely agree that there is no big pharma in this right now. There's just one thing: big humanity. And I think the governments, the different organizations like AAPM and GRIT, and everybody is coming together to just have like one organization that is us as humans, which has crossed all borders and broken all barriers. And same thing on the cost side. Different governments are willing to share the cost and bear the burden of therapies and treatment, because if you don't, then your cost of not treating is way more exponential. So I don't think people are worried about making money or cost at this point of time, or whose patent should it be. We all want to find a solution in this together.
Yeah, thank you so much, Dr. Mathur. It's just so exciting being on both ends almost to see the spectrum of things being tested, all the way from new therapies to new vaccines to new drugs to old drugs and repurposing old drugs. I know you mentioned, antivirals. They were looking at some HIV medications that worked before, possibilities of those, anti-malarials, anti-tuberculous, with the BCG type. Recently, hot off the press from the FDA, they're approving research into blood products. I'm sure you've heard about convalescent plasma and hyperimmune globulin. Basically, the thought process behind that is if a patient is recovered and they're developing some of these antibodies and immunity, can we siphon that off in some way and give that to newer patients? And I think this kind of research really is an all hands on deck. Everybody's coming together. Everybody is trying out their ideas to really see what we can do to get through this together. So thank you so much for those comments. Ben, are there any other audience questions that they would like to ask?
I'm not seeing anyone else that has any questions coming in or anyone raising their hand. So I think at this time we could probably pass it over to Catherine and they could take it away from here.
No, sounds great, Ben. Thank you so much for that, helping me. And audience members, thank you so much for your questions. Feel free, like I said, to spread the word and continue to join us. We'll have another session next Saturday where we'll bring in some newer experts as well. And we'll be continuing this conversation. So with that, I'll turn it over to you guys at Grit Health. And we have a wonderful session coming up with Dr. Catherine Benedict and Swamini. So really excited. Please do join us and continue to stay for that. Thank you.
Thank you, Arun. I just wanted to start by saying, as I was listening to everyone talk over the last hour or so, it really was we bounced back and forth from talking on the science and medical front to talking about the emotions. And I think that that clarifies or that really signifies what we're all facing right now. We have to juggle staying informed and paying attention to the information that's out there, so we are being safe and we're keeping our family safe while juggling all the emotions that come up with that. There's a lot of uncertainty. And I mentioned this last week, in times of uncertainty, it really feels like negative emotions bubble to the surface a whole lot easier than positive ones. Uncertainty is actually a pretty neutral term. It just means we don't know what's going to happen in the future, but it could be good and it could be tough. Thank you, Dr. Mathur, for including resilience in your prosper. I think it's so important in finding calm. And it can be difficult to figure out how to get from uncertainty and get over the hurdle of some of those difficult emotions to finding calm and finding resilience. Something Lauren talked about last week was as people affected by cancer, we might have muscle memory in handling difficult emotions in challenging times. So how do we tap into those strengths and those coping skills? So with that, I want to introduce our guest today, Swamini, who's a spiritual leader. And before we take it away, I'm going to let her introduce herself. Swamini, can you, you're already unmuted. You take it away.
Hi, hello everybody, namaste, which means I honor you, and I'm so happy to be here and to be part of this speakers panel. And so I am the co-founder of an organization, Kula Kamala Foundation, and there's also an ashram or a spiritual school that is associated with the foundation. The foundation started about 13 years ago. It was my calling at that point in time to bring the benefits of mindfulness and yoga into the healthcare field. And so I worked over these years with about 13 different hospitals, with different mental health organizations, with organizations that handle at-risk youth and their families in crisis, and many, many other areas. We bring mindfulness and spirituality to anyone and everyone who is interested. I've sat with people across the spectrum of life, from their arrival into this life to their exit from this life. And the one thing that I have just consistently found is that these practices are beyond powerful, and they are personal. And they really do have the gift of addressing what is needed in a given moment from a personal, internal perspective. So it's, the healthcare facilities, the healthcare practitioners, the doctors, the researchers. I applaud all of you, your courage, your bravery in handling this. The heads of nonprofit organizations, Curtis and Cathy. The work that you're doing is absolutely crucial. It's beyond crucial. There's really not a word, I don't think, in the English dictionary to describe what it is exactly that you're doing. So very important. And then the second part of that is what is happening on the inside of every single one of us. And so that's my area of specialty of teaching for all of these years. And I'm happy to be here to share that. And I just want to say a little something too, that my connection with cancer is that I lost my husband 1.5 years ago. He was diagnosed with stage 4 colon cancer. And he was told at the time that he was diagnosed that he would potentially have less than a year to live. And through some amazing support via the hospital and the doctors and the chemotherapy technicians and the nurses and everyone who was involved there, as well as his own spiritual mindfulness practice, he actually survived 5 years. And they were 5 amazing years. And I believe, Dave, you were talking a bit about this, and that Dr. Mishra might have been also. He would be in complete agreement. Cancer changed his entire life, and it was for the better. It was for the better. And so he would not go back to the way things were before. He always said that it was a blessing in disguise for him. And so I'm here just trying to give back to a community that has meant so much to me and to him. So thank you.
Thank you. So last week we talked a little bit about, again, taking care of ourselves and what we can do when we're uncertain about going outside and our normal routine is being disrupted. And so we talked a little bit about breathing, but I'm going to pass it to you. Take us back to the beginning. What is breathing? Which sounds like a silly question because we're all doing it all the time. but explain to us a little bit more about why it's so important to focus on our breath.
Absolutely. And actually, it's not silly. As we're learning from the very crisis that we find ourselves in, it's very important to go back to step one so that we get a full picture of what it is that we're looking at. So what is the breath? Well, the breath is a life-sustaining cycle that has biological, psychological, and spiritual relevance to every single person. It is a process or a cycle that truly affects us at all levels of our existence. In some great part because the quality of our breathing, how we're breathing, how fast, how slow, how deep, how shallow, how aware we are of the breath, directly impacts the function of our nervous system. And our nervous system regulates our entire being. So very, very important. But the breath is a cycle. In the physical aspect of the breath, it supports and influences growth and physical healing through nourishment and detoxification. So we breathe in and we're nourished through oxygen and nutrients. We breathe out and we detoxify. A lot of times people think that bowel movement, urination, and sweat are the primary ways that we release toxins from the body. But actually, according to some research, up to 70% of the toxins in the body is actually released on the exhale. So if you are not exhaling appropriately, then you are not detoxifying appropriately. And if you're not countering that with a really wonderful inhale, then you're also not receiving the nutrients that you need in order to sustain life. And the mental emotional aspect of breathing is that the breath supports our perceptions and impressions such that they lead us toward either a state of responsiveness or a state of reaction. And responsiveness is really what we want to achieve in this life. We want to be able to be present to what is happening around us, to what is happening within us, and to be less reactive, because reactivity, when it's not healthy, leads us into a state of stress and tension that actually takes life enhancing energy away from us and uses it to feed into the fight, flight, or freeze response of the nervous system versus the relaxation or problem-solving, creative, logical aspect of our functioning. And then finally, the spiritual aspect of our breathing is that the better we breathe, the more connected we feel. Typically, unity, altruism, faith, goodness, all of these qualities come from a place of, at least that has something to do with the quality of our breathing. So that's kind of it in a nutshell.
So what I'm hearing loud and clear is that there's both a physical component and a mental health component. So what happens in a time like this where our stress response, the fight, flight, or freeze is kind of uber activated? What's happening right now to our breath, and how do we, I don't want to use the word combat because that's too aggressive, but how do we address that in terms of making the best of what we're facing?
Absolutely. So I think that, for the most part, none of us expected this. And so when this came down, it hit us like a ton of bricks. So if you would like to know what the news of COVID-19 has done to our breathing and to everything that is associated with that, then you can very easily find out by dropping a brick on your foot. Yes. And now you've all got the imaginative picture in your mind about losing your breath. And in that moment where the breath is lost, as soon as that brick makes contact, all the functions of the body begin to change. And your awareness moves away from a place of potentially seeking connection and thriving and happiness to a place of just wanting to survive. And so we find that we are in a place of grasping. We're in a place of critical judgments. And I don't mean that in a good way. I mean the kind of judgments where we're calling people names, we're lashing out, we're just being judgmental. And we are in a place of fear and anxiety because we're not breathing. We're not breathing. The breath is stuck up here somewhere. And as a result, Our circulation is suffering, our digestion is suffering, our cell health is suffering, our ability to communicate is suffering, our ability to connect with each other on the level field of empathy is suffering, our ability to listen consciously to what is actually being offered, and our ability to discern between what is false or ridiculous and what is accurate and sounds true is actually suffering as well.
Exactly. If you go to that moment where the brick hits your foot, everything is thrown off course. Can you give us your best advice for what we can do right now, focusing on our breath in our daily lives, with recognition that we're stuck at home, there's children running around and screaming, whatever the situation might be? What is your best advice for us?
Absolutely. So the first thing that I want to say is don't underestimate the power of breathing. If you can make your way in any given moment into a mindful breath, and let's be honest, you're breathing anyway, right? So thank goodness you're breathing. So utilize that practice in a way that is highly conscious. And when you feel that the anxiety is creeping up and you're like, well, you know, I think I'm going to go on to one of these internet sites and go find out what they're saying the deal is today. Maybe instead of doing that, sit down and breathe. Sit down, close your eyes, and come into connection with your breath. Recognize the in-breath, recognize the out-breath, and recognize that all other living beings are breathing too. And this is one of the primary connections, right? This is the connection, is that we are all of us who are alive in this moment are breathing. And there's something there that we can be deeply grateful for. So the first thing that we can do is we can sit down, we can close the eyes, and we can come into a place of conscious breathing. We don't have to change anything about the breath. We don't have to try to make it deeper or longer or more calm and relaxed. If we just pay attention to it, those things will naturally happen. In a matter of 3 to 5 breaths, what you will typically find is that by putting your conscious awareness into the act of breathing, you will deepen your breath, slow down your breath, feel more grounded, recognize how very tired and overwhelmed you are and how much that's sucking the life right out of you. Recognize how stressed you have been, because it will be countered by the experience of relaxation. Now, I understand that today, being that many of us are in close quarters with, you know, our families and children, and there may be some chaotic energies happening there as the kids become a bit tired of being cooped up. So then what we can do is breathe together. We can come into our family unit and we can sit back to back. And this is something that I've actually used quite often in my work with families that are at risk, is that the connection that comes from breathing together is so powerful that you get at least a few moments of reprieve from the stress, the tension, the loud voices, and the screaming, if in fact that's what's happening, which it does in many families. So teaching your children how to breathe, being a good teacher, you breathing, you teaching your children how to breathe, and then all of you coming together and breathing together. And that would be a key component that I would suggest is important right now. And one reason for that is because the more aware you are breathing, the more aware you are of your physical condition, your mental, emotional condition, and your spiritual condition. And then the more informed you are, and the more likely you are to take appropriate measures to care for yourself. Taking appropriate measures to care for yourself could very well stop you from contracting this virus. Most people in today's world are not washing their hands. They are not wearing masks. They are not keeping 6 feet distance because they are not paying attention. They are not breathing. And if they stop and breathe, then they will have a split second where a light of opportunity comes through. And they might recognize, oh, wow, you know what? I actually am walking way too close to this person. Maybe I'm infringing on their safety space, my own safety space. I can back up, back away, using empathy and compassion as our guide. But if we are only ever breathing in that shallow, rapid, upper chest breathing of fight or flight, then we will never be concerned about the safety of the other, because we will only ever be concerned about our own survival first. Yeah.
Sonia, thank you for that. And I love the practical advice. A lot of times when I work with patients, and meditation at this point and mindfulness has kind of entered the cultural zeitgeist, a lot of times people have questions about, is there a right way to do it and is there a wrong way? And it sounds like we can get a little creative in terms of doing it with shared exercises with family members or kids. Also, for those affected by cancer or other physical ailments, deep breathing, and we got a message on our side chat, deep breathing can be difficult. So a two-part question, is there a right way and a wrong way to do this? And what is your advice when the typical recommendations of that deep breathing, inhale, exhale, is not accessible?
Yes, and so that suggestion for people to just breathe deeper sometimes causes me to cringe a little bit, because it doesn't take into consideration the fact that most people do not breathe appropriately enough in their day-to-day life to even understand what deep breathing is. So the first thing that I like to say is a slightly more relaxed breathing. Just slightly more relaxed. Don't manipulate anything, at least not initially. Just learn about how you're breathing. And as I said before, by coming into a conscious awareness of how you're breathing, your breath is going to change. It'll only be a little bit, but that little bit will absolutely matter. Now, there's a lot of fancy breathing practices available out there. Just go on YouTube, you'll find 10,000 of them. The thing that I would suggest for the cancer community is this, and this is very important. There are typically two types of breath. There is a heating breath and there is a cooling breath. The way that we breathe on our average everyday experience of life is a cooling or a neutral breath. In the yoga tradition and in other traditions as well, there are some breaths that actually can increase heat in the body. And if you have a fever, if you are currently undergoing chemotherapy treatment, radiation, or anything that has heat as its primary component, then you do not want to breathe those breathing practices. Those are not appropriate practices. They are actually highly contraindicated. You're better off to come back to either a simple awareness of your breath in 3 to 5 meditative minutes, or to breathe in a way that is cooling to the body. And cooling breaths, one is Sitali and Sitkari. These breaths are actually suggested for individuals who have fever, who are undergoing chemotherapy or radiation. And that's because they bring a sensation of coolness to the body, which can counteract the effects of excess heat. So yes, there is a right and a wrong way. Keeping it very simple, the place for everyone to begin, if you don't have a yoga therapist or a respiratory therapist or somebody around you who understands the breath, is to sit quietly, breathe as naturally as you breathe, and pay attention on purpose to all the qualities of that breath, with gratitude in your heart, not with judgment in your mind.
And judgment for oneself, right? We
Like,
talked about judging others.
Yeah.
Am I doing this right? Am I doing this wrong? Just relax. So it sounds like the message is that this is accessible for everybody. Yes. And that there's an easy place to start no matter where you are. So now I'm going to turn it over to you. When you work with your community and the individuals you work with, what are the sorts of things that you hear from people in terms of resistance or barriers, or I can't possibly do this because X, Y, Z? And what are your responses to them?
Yes, oh, that's such a good question. My response is I will typically attempt to remain calm, but on the inside I'm giggling, usually pretty loudly when they say I don't have time. And that is the first and most common reason people will give that they can't do anything that's meditative. I don't have time. Say, well, breathing doesn't take time. You're doing it already. So the question is, what quality are you willing to bring to your breathing? Will you allow it to just be an afterthought and something that you pay zero attention to? Or can you just take a moment and be like, wow, I'm actually breathing in and breathing out. Maybe I should pay attention to this miracle. And that actually is what the breath is. The breath is a miracle when you think about how the breath is so integrated into our overall being. It is beyond inspiring. It is worth looking at. The Grand Canyon is not more beautiful than your breath. The night sky is not more amazing and expansive than your breath. Nothing is as miraculous as your breath. It deserves your attention. So this is, on one level, a conversation that I will have with people, inspiring them to become intrigued, interested, and curious about what their breath can do with them. And education is key for that, for people to understand that it could save their life. You know, my husband had a history professor, I think it was, in college, and he would always do an impression of him. He would say, "This history professor, nobody ever listened to anything he ever said, except one thing. Every once in a while, he would stop the class and he would say, 'The air you breathe will save your life.'" And that's what I'm going to share, is that the air you breathe will save your life. Don't you want to be invested in that? So yes, absolutely, sitting still, paying attention to the breath. Don't use time as an excuse. You've got nothing but time now. We all have time. You can come off of Facebook a little bit earlier in the evening, or go on a little bit later in the morning, and dedicate 3 sessions a day, if that's possible. If you're willing, it is possible. So we'll say, if you are willing, dedicate 3 sessions a day, 5 to 15 minutes of just paying attention to your breath, sitting comfortably, quietly, with nothing on in the background, no TV, no radio, no music, no chimes, nothing, just you and silence. Pay attention to everything that you can about the breath. And those 3 sessions daily will change the way you see yourself, the way you see all others, and the way you see life.
I love that, Swamini. Thank you. Last week, I challenged people to just take 10 breaths once a day, but this ups the ante a little bit. And I think that everybody can start, everybody can find their place with their breath and feel the positive effects. So thank you. And I want to tell all those who are still on that we're going to pick up this conversation next week. Swamini will join us again. And so I'm excited to take it the next step and to hear your guidance around that. So with that, I'll pass it to Lauren, I believe, who's going to share an update on resources.
Yeah, thank you, Catherine. Apologies if you can't hear me totally clearly. As Dave says, we are imperfectly perfect during this, and the dishwasher's running, of course, while I speak. And I'm beside the kitchen, so just had to give you guys that information and about, you know, keeping it real and honest. We're all in the struggle together. Hopefully you got a little laugh in. But yeah, thank you again to all of our panelists and speakers and everybody who attended today. It was another great session. We're doing this again next Saturday. And also on the Grit Health platform, which you can find in the App Store, or you can download it on, or you can access it on your desktop. You can just visit our website at grithealth.com. That's GRYT health.com. Thank you, Ben, for typing it in the chat box. And on that, we will be having some meetups, just a scheduled time where you know that other people are lonely or bored or need to vent or talk, just a set scheduled time. And those next week are going to be Tuesday, April 7th from 12 to 1 p.m. That's Eastern time. And we will have one again on Thursday, April 9th from 8 to 9 p.m. Eastern time. So that's what I have scheduled for next week. And you can always find me in the app as Lauren, and you won't see my messy hair. It'll be my little avatar, so everyone gets lucky with that. And I did want to go ahead, I'm just going to pull this up, some resources to share with you guys from some of our nonprofit partners. First off, Cathy gave us some great information about the resources and things Living Beyond Breast Cancer are doing. And thank you, Curtis, for doing the same for things Crush It for Curtis Foundation is doing during this time to help out patients. I also wanted to share that one of our partners, Elephants in Tea, has a really beautifully organized part of their website with tons and tons of resources and clickable links and stuff like that. So it's super easy to use. BMT InfoNet has, which is the Blood and Marrow Transplant Information Network. They have information about what transplant recipients need to know, and they also added a page for tips on how to cope with anxiety during this. Family Reach offers financial support that you can go on their website and apply to, and they also recently started a new campaign called the #WeSeeYou, and they are hoping that people will use that hashtag to raise awareness about cancer patients going through COVID-19, and hopefully just let the cancer community know that we're not alone. So if you're posting about anything related to your cancer journey or COVID or what you're doing to get by, use that hashtag #WeSeeYou. The Metastatic Breast Cancer Alliance is providing patients with resources from their members and partners about COVID on their website, which is mbcalliance.org. Another breast cancer focused organization, the Young Survival Coalition, or better known as YSC, has a few blogs up and has virtual meetups scheduled. You can find that on their website and Facebook. And for kind of continuing that conversation of being active, Epic Experience is one of our nonprofit partners, and on their website and Facebook, you can find information about a weekly walking workout, a yoga workout, and then I mentioned this last week, and I promise this week I'm actually going to do it, their ballroom dance class. I mentioned it last week, and I'm going to do it this week. I'm going to put it on my calendar and listen to what one of our panelists said and really try to organize myself and set time on my schedule for that. Last week we had Suzanne on from the Livestrong Foundation, and they are they still have really great resources on their website. And then lastly, I wanted to go ahead and mention Cancer Care. They have a couple of different workshops scheduled. They have some fact sheets about coping with anxiety during COVID, and they also have a financial assistance fund. And so to find information on anything COVID related, you can visit them at cancercare.org/coronavirus. And so I just wanted to tell you guys about these resources, but also let you know that this week I will be getting them updated onto our actual website. We have Live Now, which everyone joined from today, so that's really exciting. So just know that the resources are out there, and we're here to help you. All of these nonprofits, all of these organizations are here to give you information and help, because we're all in this together. And as some of the panelists have said, you need to be finding solutions to help yourself first and help others. And we're all in this together. This is something we keep repeating, and just really ground yourself and use what you know and use what works for you. Experiences you might have had as you were in treatment for cancer, or how you've coped with your mental health as a survivor 3, 5, 10 years out. Revert back to that. You got through that, and we're going to get through this together. And we're here for you, and we're hoping to see you again next Saturday. And as a reminder, everything from today will be recorded, and you will be able to access it and view it again on Monday. So just keep up with us on social media. You can find us on Instagram and Facebook, Grit Health, and we will be updating those resources. And I just want to thank you all again for being with us today, and we hope to see you next week as well.